Hello, my name is Kathleen Elmore. I'm the co-founder and managing director of Engageous. Engageous is a healthcare consultancy laser focused on driving better consumer health engagement. My background is companies like General Mills, Procter & Gamble. I like to say I was getting you to eat when you weren't hungry and buy things you didn't need. And so I was thrilled to come over to healthcare in 2005 and use all those same methodologies, targeting, segmentation, A/B testing, and most of all behavioral science, to get you to do good things instead of evil. So the focus of today is really how behavioral science is driving consumer engagement. And again, these behavioral science tactics are things that have been used in the consumer world for decades, right? When Amazon tells you there's only 4 left in your cart, you know it's a marketing tactic, but yet it gets you to act. We bring these same tactics to bear in healthcare to drive positive behaviors in health. We use it to close gaps in care, to prevent readmissions, to get folks to get vaccinated, to get people back into care from this last year has been really powerful. Our clients are health plans, health tech, PBMs, and provider systems. And so how we do it is we basically soup to nuts look at their entire engagement stream. Who are they talking to? How are they going out across different channels, digital and otherwise? What is the segmentation they're using? How are they thinking about everything from the time of day that it's reaching them, to that subject line, to those benefits, right? And then also overcoming barriers. In my past life, the benefit was critical to driving behavior because in most cases the barrier was price. In healthcare, we all know the reasons to go get a mammogram or go get a colorectal screening, but the barriers become much more important. And some of those are intrinsic, right? Of, fear or guilt or inertia. Other those are extrinsic, things like the social determinants of health barriers. So using behavioral science to overcome all of those barriers to get people to take better care of themselves has been really powerful. We partnered with the American Cancer Society in the last year. They had added diversity to their latest CP3 study. The CP3 study is the longitudinal cancer study looking at behaviors versus outcomes over a long time. And to make that more relevant to the total population in the US, they added diverse populations, and with that came challenges in engagement. And so to keep their study from losing people, which would create bias, they came to us for help. So we helped them through adding things like endowment effect, scarcity, FOMO, authority, all of these great behavioral science tactics we baked into their programs, into their messages, into their scripting. And sure enough, we were able to get people back into the study, which was really great. Another example of using behavioral science tactics successfully was we worked with a health tech organization who was helping chronically ill, vulnerable populations in Medicaid. And they were helping them get on to SSI benefits, right? Really, really powerful. And so we went in, we looked at beginning to end all of their engagement tactics, how they were using print letters, what their authority was, right? If they added their logos versus the plan they were working with logos. We added a double window because that way you see a date, and sometimes a date makes you think it's time sensitive and you're more likely to open the envelope. We added a stronger call to benefits. We added messaging to overcome barriers. And so overall, we ended up increasing the uptake in people getting onto SSI benefits who really needed it from 19 to 30%. So some terrific outcomes on that program. For more information, you can go to our website, engageous.com, ENGAGYS.